Board 2 session. Have to be posted. This agenda was posted in the office of the county clerk on the 19th day of January 2022. Notice was sent to West Bend Daily News, Express News, WIBD, WMBC Radio, WTKM Radio, My Community Now, Hartford Times Press, Kewaskum Statesman, and Milwaukee Journal Sentinel. Would you please rise for the Pledge of Allegiance? I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
All here and everybody's healthy, so that's a good thing. Stifle that, Donna. All right. The first item on our agenda is our consent agenda. I would entertain a motion to approve.
So moved.
I'll second it, but I do have some questions that I'd like to ask about the vaccine policy, Samaritan.
On item C?
Yeah,
Okay, so we'll pull that one out.
well, might be in B. Let me check where it actually was.
Okay.
What I want to talk about is what's going on at the Samaritan as far as the mandate. So whichever
C,
one that's
pulling
in.
out of consent to discussion, Chris?
I think C. Yeah, that's the one I said.
Okay,
That looks like that's gonna come.
So first we need to approve the consent and then we can.
All right, it was my understanding you pulled that item out. We'd approve the consent agenda with the other three and then take up item C.
Yep.
Okay, so that's the motion, I'm assuming, is that all right?
Yes.
All those in favor, please signify by saying aye.
Aye.
Opposed? All right, and that motion carries. So then the Samaritan Campus Mandatory COVID-19 Vaccine Policy. What were your questions?
okay, so let's see where I got my notes. I guess I'm wondering how this mandate is affecting the Samaritan. How many people are exempt? Are there any, or actually, I want to know, how does the exemption work? And who's the approving person for an exemption? And do we have, is it causing an issue? You want to take it? Go ahead.
Sure, yeah.
Okay.
So, to answer, first of all, the first kind of committee that's approving the exemptions, for medical exemptions, it's first being forwarded to our medical director. And our medical director is approving any medical exemptions. And then the religious exemptions are being approved, in collaboration with HR and then Eileen from the county attorney's office. They're reviewing each and every one. If there's any kind of appeal, they have 5 days to appeal if they don't agree. I believe that goes to Todd, the human resources director, with Brad.
Okay. And do we have a lot of issues at the Samaritan right now that you're aware of, or is it too early to tell?
It hasn't, we have just a handful left. We've been reaching out to everybody. We've had one employee who said, I don't feel comfortable getting the vaccine and I don't feel comfortable submitting a religious exemption because I'm not religious. And that is the only one that we've really had impact staffing wise.
So she has decided to resign.
So she's
already put
decided
in her
to do what?
notice.
To resign.
To resign, oh. Well, that's too bad. Let's see, I think I had a few other things. Yeah, no, actually, that is what I wanted to know, is it is affecting your staffing, and it appears like it's really not, so that's a good thing. Okay, good to know.
And I would just add the committee, the HR and the county attorney staff persons that are reviewing it, they both review them separately. And then they come to their agreement together. At this point, I don't believe we have any religious exemptions that have not been approved.
Okay.
So those are being approved based on that sort of third party review.
Okay, and it doesn't have to go to the state or to anybody else, it's all internal?
Yes.
Okay,
And so what the campus administrator, Taya, will have to do in partnership with HR is maintain all of those records and all of that, that paperwork, so that if we had a surveyor come out and wanted to know, how we are with complying with this rule, they would have to show them all of those materials. And then as we're hiring new staff, we're requiring that they're vaccinated prior to their start.
And then can they ask for an exemption, a new employee too?
Yes.
Okay, all right, thank you.
Thank you.
I have some more questions regarding that. Now, the religious exemption, do you actually have guidelines? Because I have some concerns about religious exemptions with somebody, beyond me deciding if my religious exemption is valid or not, because those are my own personal beliefs and values. Currently the current president's administration doesn't have any specific guidelines out there yet. So I'm wondering if Samaritan does, or how are you working through that?
So that's the reason for having the separate committee approving that, so that it's not the campus administrator or any staff at Samaritan approving that. And while staff can contact HR for advice, obviously we cannot, and they cannot write up anybody's exemptions for them, but they can give them some advice. But it does get into a tricky area, right, especially around civil rights and people's religious freedoms. And so I think that the county attorney's office and the HR's office is really, making sure that they're reviewing those with the, eye on making sure that we're protected as a county and that we're protecting employees' rights as well. And so far I haven't seen anything that's been an issue with, like I said, we have not unapproved any of those at this point.
Okay, thank you. Yeah, I know at the national level, there was just about a week or two ago for the role that I serve in, there are our monthly national updates. And in that press conference, actually it's a live press conference anybody can listen to, the question was asked by the media about religious exemptions. And at that point, it was about 2 weeks ago, nationally, all religious exemptions that had been written were supposedly accepted, that had been reviewed at that time for people who were federal employees. But it was individuals who did neither that was a concern. But go ahead.
I was just gonna say, and for anybody who has an exemption on file, whether it be medical or religious, they do have to adhere to masking and testing. It's not that big of a deal for the Samaritans since they've been doing that for the last 2 years anyhow. So that will just be something that they continue to do for those employees.
Yeah, and masking was a common practice in place for individuals who exempted from the flu vaccine in the past. So I know a lot of health professionals are accustomed to that. I do have some questions too then regarding the medical exemptions. Is Samaritan acknowledging natural immunity or not yet at this point? Like if you submit, a positive antibody test.
Yeah, at this time, our guidance that we're receiving from CMS is either vaccinated or not. So until that changes on the CMS level, we're not accepting natural immunity.
Okay, so you're following those actual medical guidelines, because really the only medical exemptions are the allergy and anaphylactic reaction. Normally historically there's been, other medical exemptions for vaccines, but for some reason not with this. Thank you.
And then I had another question about how is Omicron, because I heard at the last Monday's WCA meeting that Omicron is peaking in Wisconsin. Is that having an effect at the Samaritan? And can you just say where are we at right now with it?
Where are we at? So it really started peaking like over Christmas, from like Christmas into the new year. In January, I mean, I can't give an exact number. We've had over 30 staff test positive, and it's been a complete mix of vaccinated, unvaccinated, symptomatic, completely no symptoms, just completely across the board. We had 3 residents in our red zone, which is our COVID unit. They are all back to normal, back to their own rooms. We currently found out today we have 1 resident that was asymptomatic and tested positive today.
And do they need to be isolated? Does that person have to be isolated then?
Yep, we have a designated unit on our 4th floor north hallway.
Okay.
It's separated kind of by the zip line wall thing. And so they go there for the 10 days.
Okay.
Yeah, countywide, I just looked at the dashboard. In about the last 2 weeks, we've gone down from 2,700 cases a day to under 700 now. So it's been a steady decrease since that peak of 2,700. So it looks like it's on
That's
the way
pretty
down.
dramatic.
Yeah. So it looks like it's getting down to the bottom, so.
Yeah. But I would say that the outbreak at Samaritan has been consistent with what we've seen across the country, in the last, couple of months. And it's the highest number of staff that have been positive in the last 2 years. So it was, I feel like, very stressful 4 to 6 weeks.
Yeah.
Because not only, are there extra precautions that then go into effect when there's an outbreak status in the nursing home, but then also obviously you're having staff that are out, and then you're having, residents who are needing that isolated care. So it was a lot. And I would say the staff at Samaritan have been continuing to persevere, and we should be very proud of the work that they do and their commitment to continuing to provide care for our residents, because this is just seems to be an extra layer every time you turn around of additional things that they have to manage during this pandemic.
Well, someday it will be gone.
Let's hope so.
A question, you speak of their essentially quarantine for 10 days. What type of care is still provided to them during that 10 days? Nurse worked, now helped out on the front lines too, and, just concerned of, some individuals, are they still, are blinds open, basic care is, because this is really where they need the excellent nursing care, they need the mobility, they need delirium prevention techniques. So I'm curious what you all have in place.
Yeah, we still do all of the regular normal cares we do with the our activities and dining and things like that. They have to stay in our rooms, but our activities staff will do one-on-ones. They'll garb up and they'll do one-on-ones with the residents. It hasn't, I think it's a lot better now, even the 4 days less is helping, but yeah, we still keep the same quality of care.
Or even maybe, enhanced, even, like I said, more delirium prevention and, prevention of, healthcare infections, other secondary infections and side effects.
From my perspective, really, the care doesn't change, the location of the resident changes, and then the staff have to utilize that extra PPE. They don't usually go in with gowns and, the N95 and the face shield. But when they're providing those cares during that time, then that's what they're doing. But it's really about keeping those residents away from the other residents, but the care continues to be at the same level. Except for the change in dining for them, that they eat their meals in the room.
Yeah, because I just would like to see even more proactive preventive measures to help with the delirium, potential side effects of just being in a room. Because a lot of times we're hurting people more than helping them.
Okay, any other, more questions?
I just had a call, a national call with one of my nursing organizations yesterday, and we were, speaking of moral distress of caregivers. And I'm concerned too about the, is the moral distress of the caregivers at Samaritan, or how are people handling this?
Yes, in a sad way, but a good way, I think people have gotten very used to it. I think it is challenging between like the staffing shortage, not COVID related. I think the staffing shortage, especially when we had in the summer, I think that causes more hardship on the staff really than COVID. Like when we've checked on staff and things, they're kind of like, we've got this, feel very confident, and sadly, I think people are very used to it. We've been lucky that our residents a lot of them have been asymptomatic and haven't gotten real sick, so I think we've been lucky in that capacity, or fortunate.
All right, thank you.
But that's a very valid concern. We appreciate it.
And then if someone is struggling, resources like people, like the employee assistance programs or extra additional resources?
Yeah, I think typically what I observe is, there's just a lot of teaming that happens in conversations with staff. We've been, not able to take as many admissions because when we're in outbreak status, so, we're at a lower census than we have been before. And so, the team seems to be, very cohesive in that way. And then of course we have all of your typical things that we offer at the county EAP, and, HR comes in and to provide support, and, just those personal conversations. And there's been a lot of work being done with, Taya having come on as the administrator last spring, and we have a new director of nursing to really, look at how our nursing manager and the nursing leads provide that support to the floor CNAs and the floor nurses. And I feel like they've been doing a really good job of trying to improve that. It's always a work in progress, but to really keep their eye on that, I've been pretty impressed with that.
All right, thank you.
Yep.
Okay, any other questions? Peter?
Yes. I think people are at the stage right now where they don't care. I did a show Saturday night at the Pabst Theater, and it was packed. They had the mask on? Sure did. But everybody was happy they were out and having a good time and enjoying what was going on there. And I said, what about Pat? Nobody was talking about Pat. They were just talking about the fact that they were out, having a good time. And believe me, I spent 42 days in the hospital, and I know what the deal is. But so the boss told me to wear a mask, and I'm wearing a mask. But people want to go back to the way it was. If it's going to go back to that, who knows? It's going down now. It'll be back up again, unless people are using that extra careful situation that's going on. Some people they wanted to go back to the way it was. But thank you.
Taya, would you please take the committee's gratitude back to the employees?
Absolutely.
And thank them for a job well done under the circumstances. That's terrific.
We'll appreciate that.
Okay. All right, there being no further questions, then do we need a motion to accept this report? Do you know?
Are we done?
Well, it was on consent agenda.
We moved it to discussion.
I don't think so. It's just a discussion item. So it's.
Yeah, no.
Okay, then we'll move on to item 5, which are additional discussion items.
Yeah.
The first one being Aging and Disability Resource Center, Hartford office update, which was in the paper already.
The front page.
Yes,
I beat out
who
the
leaked that?
pandemic.
Who leaked that before
I
you
did.
tell the committee?
I always knew you were a very important department and person.
That's how I made it on the front page. I did ask the staff that day to refer to me as Anderson, because I like when they, in the paper, Anderson, and they did. So back in October, we were notified by the law firm next to the resource center in Hartford that the building was for sale, but there would be no changes to the lease agreement. It was gonna be an internal sale because one of the lawyers was retiring. And then that was not true. So then in November, we were notified that the building was sold. So United Way leased the building from the law firm and we subleased from United Way along with some other organizations as well. So we officially moved out of the resource center on Friday. The building was sold and United Way is currently displaced completely. They are working on a lease agreement for a West Bend location and also working through some details of a potential purchase of a building in Hartford. So we do intend to partner with them, downsizing the space that we have with them, and all the rest is kind of unknown at this point. Our services will not change. We are able to do home visits if needed. We can work out a public meeting space, maybe at the library in Hartford, offer people taxi tickets to come to the West Bend office if they don't want us to meet in their home. So we don't anticipate any change in services. Unfortunately, we just don't have a location in Hartford to work out of.
But that's coming, that'll be coming down the road.
We're hoping so. We're hoping to partner with United Way. So we were staffing the Hartford office with 2 people 3 days a week prior to the pandemic. Once the pandemic hit, nobody was staffing anything. And then United Way really didn't open the building back up to the public for quite some time. So we did have staff going out there, but more for the fact of maybe they had an appointment in a Hartford home. So we were down to staffing the building 3 days a week with 1 person. So our intention with future partnership with United Way would be to have 1 office in Hartford, staffing it 3 days a week or as needed.
Lots of empty storefronts where the Kmart used to be.
Yes, except for the Festival Foods is going in there.
Well, that's the whole thing.
United Way's been looking. We've also been contacted by some other organizations about potential space.
Cool.
But with all the unknowns right now of this building that they're hoping to purchase, which would be a really great location, really great office space, we're just kind of holding out.
Okay, good.
Oh, that's nice that you still want
Any
to partner.
questions from anybody? Okay, well, you'll keep us up to date on
I
this
will.
as it
Yes,
progresses.
Absolutely.
Great, thanks, Tammy.
you're welcome.
All right, then item B, contract to retain the Sigma Group for Samaritan Build.
Right, and this is to give the committee an update that we're doing nothing yet until we see, Julie sent out an email that February 21st, we are expecting to receive information regarding the grant of $12 million. And if we would receive that grant, we would begin to contract with Sigma Group. It's an engineering firm for environment, and they would review the property that we are looking at, which I included on the second page. And this is a combination of a 15.1 acre and a 8.8 acre piece of property. There is some wetland and floodplain that we would have to be looking at to see whether or not we can maneuver that in order to be able to build a 48-bed skilled nursing and a 32-bed CBRF and that assisted living, and that these would be modules that would be able to convert into, as the need would arise, we would begin to review skilled nursing and go to more assisted living, or vice versa. You could do either.
Okay. But that contract with Sigma hasn't been signed yet?
No, it went through the attorney's office, and I was hoping before the ground froze, we could get started. But since we're in a situation today that the ground is frozen, we're gonna hold off until we see whether or not we receive the grant. They need approximately 3 months to get it completed, their portion, to work with the city, to work with the county. And we need that before the architect can finalize the whole layout. And is it feasible or not?
And I just want to add, like, the purpose of just bringing this forth as a discussion and informing you is that if we are given the dollars through the grant to proceed with Samaritan, I know our policy director wants to move forward pretty quickly with signing that contract. And so, just want you to be aware that that is something that will happen so that we can start getting that work done. But obviously we'll wait to see what happens with that. And we're utilizing strategic priority funds, which are already budgeted. So there's no request from this committee or the board for funding. And so we just wanted you to be well aware. So in case we needed to pull the trigger, you didn't feel like you were uninformed.
Yeah, thank you, I appreciate it because a lot of people keep asking.
Any questions on this? Okay,
Thank you.
then we'll go on to the next item, which is the family support assistant position.
So this agenda item and the next agenda item, again, is something that we're bringing forth to committee to make you aware of. There's no requirement or need for approval because of the fact that the dollars are already budgeted, but because we are moving the budget dollars around from what's originally was written out into the 2022 and 2023 budget. Want to make sure that you're aware, and if you have any strong feelings, we can discuss that. But as the family support assistant position, apologies, you did not get that information ahead of time, but it is printed out for you. But I do want Coral Coral Klein, our division manager for children and families, to just discuss this position a little bit, especially since you didn't get the opportunity to read the report ahead of time. So you have an understanding of what this position does.
Sure. The Family Support Assistant is an integral part to our Child Protective Services program. Their biggest role is providing supervised family interaction when children are removed from the home, but still obviously need to visit with their parents, and for parents to work on parenting skills and continue the bond with their kids. They also do a lot of parent mentoring, coaching, hands-on education in the community, in the building. They work on the parenting and nurturing curriculum. They do a lot of skill building with parents who are possibly parenting sober for the first time in a long time. They really are sort of this hands-on piece regarding the keeping the relationship between the parent and the child and building those skills. They also do things like home management, parents who are having a hard time, everything from budgeting to getting their kids up for school, for setting boundaries with their children. Really, those hands-on parenting skills and support is what they do for their job. And then they work very closely with our social workers on case plan goals, with, of course, the outcome of hopefully quickly reunifying kids with their parents whenever possible. And I'm not sure, I'm sorry, Julie, I didn't see what you had sent out, but there's already we have two full-time, we have the two full-time family support assistants now. And we had an additional 0.7 that was allocated, which has been sitting vacant. And then I know this group has heard around targeted safety support funding services. That was sort of our in-home program to do safety checks, but also parenting support is sort of this complementary service. So it's well within sort of that funding structure to be able to take some dollars to add to make this a full-time parenting family support assistant so that they can go in, work on safety concerns with the parents, and then provide that complimentary service of parent coaching and mentoring as sort of a whole package deal, if you will, so.
And I would just add, so essentially what we're doing is moving this position from 0.7 to a full-time FTE for a number of reasons. As Coral has discussed, the work in and of itself, it's also a recruitment. Not a lot of people want a 0.7 position. And also then, while there are the benefits that go along with it, the insurance is more costly for somebody who's considered a 0.7 versus a 1.0. We do have the dollars already in the budget. We were contracting with one of our providers to provide some of the services for us. As you know, the way in which human services is provided in our county is a mix of county staff doing the work and a mix of contracted staff. And sometimes contracted staff makes sense and sometimes it doesn't. And so we did have a contract last year and we were not satisfied with what we were getting for what we were paying. And so we did end that contract at the end of the year and have decided to use some of those funds to make this a full-time position.
When I looked at the papers again for today's meeting, this was there. So I did get to read this before. I don't know when it went on, but it was there at least today, so.
3:30, I think.
Questions from anybody on this? Yes.
Yes, so is this position currently vacant? Okay, the 0.7.
The 0.7 is currently vacant, right?
Okay.
And we're waiting to recruit for it until we can, we need to bring it forth to committee so that you're aware, and then the budget office will let us to start recruiting for that.
Okay. And just a bigger question, how does a family get referred to obtain these services? I know I've asked this in the past, is it just more like through the school systems, or how does
Sure, so this particular service would be great to be a community-wide service on many fronts. This is specific to the Child Protective Services Program. So you would have to have a referral of abuse and neglect and then be screened in for services for the department.
Any other questions? Okay. All right, that was a discussion item. No motion is required, so we'll move on to the next one. Which is the Assistant Supervisor Position Youth Treatment Services Team.
Yes,
They
so
have that one
very,
in front of them.
what's that?
They have it in front of them.
Yeah. So very similar discussion, also connected to the child welfare and youth justice program as well as behavioral health. You may recall several months ago, we brought forth to this committee that approval to accept a youth innovation grant. And we received $150,000 for the first year and $75,000 for a second year to implement a program called Family Centered Treatment. We also, in preparation for receipt of this money, did put an additional therapy position in our 2022 budget. So we are using this funding to hire 3 therapists to provide, to essentially implement and execute a national home visiting model for youth and children in child welfare, aimed at trying to keep kids and families together and children in their home. And it's an intensive in-home therapy that will support, essentially I already said that, support children in trying to keep them out of home care, out of residential treatment. And so one part of this program is that there needs to be a supervisor who becomes the trainer, because as you can imagine with a national model, we're going to go through all the training. There's a lot of fidelity assurance to that model. But if we lose staff, say somebody resigns, then we have to bring on a new person, they have to get trained. And so the sustainability component of that is that you have the supervisor become the trainer so that you don't have to keep paying for staff to be trained. We currently have a position that is a youth, under our youth team, that is a coordinator And she does some higher level administrative things for that program. But she doesn't directly supervise anybody and does not directly have the capability to do performance evaluations because she doesn't have the title for that. So we do want to use some funding that we have in a position that we're not filling to bump up that position to an assistant supervisor so that she can supervise these therapists as well as become nationally trained in this model so that we can assure the sustainability of this program. This funding, again, is we have a case management position that we chose not to fill internally. We filled it in an external contract that is fee for service. And so what that means is we have a vendor that provides case management services for us, and they bill Medicaid for those services and they get that reimbursement. And so we have a held open county position that we are utilizing those funds to increase this position, as well as next month, I'm going to be bringing forth a discussion about a summer intern. The budget office has already done what they need to do to make sure that we don't have, that our position allocations are correct, that we don't have all these positions out there and we don't accidentally fill them in the future, I suppose. And so that is what we're proposing, and just want your questions and feedback on that.
Okay, any questions?
No questions,
Okay.
just, this amazes me. I think what you guys share. I'm always very humbled and people ask, what the role and how challenging it is. I say, actually, it's a privilege to sit in this meeting and listen to you all and how you're figuring this out business-wise and budget-wise. That was one role I never did on any of the boards I served. And so I just really appreciate the work you guys do. My goodness. And I mean, these are tough positions. My daughter has a master's in psychology, works with autistic children in a residential facility. And this is tough work. How, and you use contractors, contract positions in the past. How do you end up recruiting for this, or is there any type of mentoring, succession type of planning maybe that you utilize in other roles to encourage people to maybe go down this type of route, or
Yeah, it's a great question. So for therapists specifically, especially individuals who want to do therapy in a county-run mental health center, it does take a specialized person who has an interest in not only working with maybe chronically persistently mentally ill individuals, but then for this particular program, wanting to work within the family and the family system, and also meeting their needs that are not 9 to 5, right? They need, parents are working, so they need nights and weekends. And so it is a more challenging position to fill. But one of the changes that we made a couple of years ago was offering to bring on therapists who were in training. And so what that means is you have your master's degree, you've done all of your, clinical hours for your degree, but you still need your 3,000 hours to become either a licensed clinical social worker or a licensed professional counselor. And so we have a great supervisory team in our behavioral health division, and they have committed to providing those hours to that staff. And so then that does help us to recruit. And then also it helps us to essentially mold and coach and train the staff that we need, because it definitely isn't the work for everybody. And from a sort of longevity standpoint, then it takes somebody about 2 years to get their 3,000 hours. And then we hope that there's some level of commitment on their end because we provided that to them. So if we can keep a therapist for 3 to 4 years, we feel like we're doing pretty good. And so the interesting thing specifically around Medicaid is you can still bill at the same level. If you're a therapist, you have to have a therapy and training license, but you can still bill at the same level as somebody who is who has their 3,000 hours and has their licensure.
Oh, interesting. I didn't know that.
Yeah, not commercial insurance or private insurance, but Medicaid, but that's, a large portion of our population, so.
I think, yeah, I've noticed that when you post these positions, you have included what you stated, essentially that training aspect. You'll take a certain individual with the right background and then provide that 3,000 hours and everything, you put that right in your posting.
Yeah, so, and I mean, that's, a lot of times in the field, therapists who need or people who are wanting to become therapists and get their hours, they have to pay someone to supervise their hours. So this is a very, it's kind of a win-win for people who are interested in this type of work. And you learn a lot from working in county-run mental health centers, so.
Thank you.
Yep.
Any other questions? Okay. Very good. All right, that takes care of that item. Then we're on to an action item.
Ooh.
Samaritan Campus write-offs request.
Love to say a
Yeah.
few things.
Yeah.
Okay, Tricia's Hill, who's our business office manager, who would explain this. And you see that we had an error in the graph that you received in your packet, and the new one is at your table. And the only error is that because we're reporting it in 22, they're thinking they need to show it in 22, but that's not the case. It's 21 losses, and the books aren't closed yet. So when they're closed, this 59,437.87 will show the loss in 21. So it's this graph, it's now corrected. As you can see, they're doing an excellent job of reducing loss. Now, part of it is not to take away from the group, but part of it is due to the census. There's less people.
Sure.
Okay, so that tells half the story.
But they're still doing a great job.
But they're still doing a great job because they're reducing it. Since Tricia's been with us, she set up a program where she meets with the family or the resident once they're discharged, and she works on a payment plan. And that's what, if you've noticed, there are 5 individuals that made payments, and these are seniors who are retired. They have very little income, so it takes a while to build up and to pay back. But as you can see, one paid $350, one paid $2,175, another one $3,900, and the last one $13,800. So her team, Tricia Holbrook's team, they've done an excellent job. There are a couple of these that I don't quite understand why there isn't a payment or a plan, and they shut it down already. And so like the third one with the co-pay days, I really can't explain that. So that one, I don't know why nothing was collected and we're writing it off. The other ones, we've received penalties, which tells me whether it's a charting error or some error why we have a discrepancy. But I see there's a couple that one at the very last one, the 1,176, an error on Medicaid side, and I'm not sure what that means. I'm not sure if that's our error or our timing or what's happened, why we have not recovered that money. I'm not certain. But overall, I think this is an excellent, excellent report. I think back in 2015, when we wrote off $450,000 in 1 year. But part of that story was the prior administrator wouldn't take any write-offs to the board. So for years, we just carried bad debt with no intent, no hope of ever recovering. And once Tricia was hired, we cleaned the books. It didn't make any sense to keep carrying it.
I have a question about,
Yes,
I think I read in here that you use TRIP when possible.
yes,
Do you also use, is that in conjunction with SDC, the state debt collection?
yes,
Okay, so I know the two of them work hand in hand, and I know
Yes.
that usually if we get something back from SDC, it's probably uncollectible.
yeah,
Yeah, that you're not gonna get it. So as long as, you're taking them all to SDC first before you bring it here.
yeah,
I know that sometimes we worked really hard to get it, when I worked in Mayville as the comptroller treasurer.
oh, sure,
And they're almost all EMT bills, not tax bills. They're,
Yeah.
ambulance bills.
yeah,
And, sometimes our biller made a mistake.
Yeah.
And, those are things that are unavoidable, but you do your own billing here, right? So,
Yes.
yeah. This looks really good. The one that I had a question about is, the $12,000, $599, and it just says patient liability not paid, second one.
that's one that I marked, what I was indicating. The person was here from January to October of 2020,
Yeah.
and I'm not sure what really happened. They all have expired, so that closes the books also. But I don't understand the story behind that. I'm sure Tricia would know what was behind that, and I don't know if anyone knows.
Oh. It would normally be, she decided that there's no way I'm ever gonna collect it.
The person's has expired, yes, but during that time, how did we end up with unpaid bill of $12,600? And it doesn't look like there was a major attempt to collect, but I don't know. This person may have gone out of state, or you don't know. Tricia would know the story.
Can that be answered? Can she let the committee know the answer to that one?
Boss?
Yes.
Yeah, I can command her. Yeah, yes.
Yeah.
So are we gonna get the real deal soon, or, what it comes down to, or? Because we don't know about this, we don't know about that, are we gonna find the real facts out soon?
What are,
You just said, we don't know, there's some things that we're not sure of.
yeah,
So I think.
Are we gonna know that soon?
Yeah, so we don't, I guess what we're saying is with that, a couple of the line items, we don't know all the details behind it because Tricia's not here.
Yeah.
What we
Right.
can have her do is write up a report for consent agenda next month so that you at least get that,
Okay,
that
that's what I'm,
resolved. Yeah,
Yeah.
absolutely.
thank you.
And 2020 is really not that old.
no,
That's what I was looking at, is it's not really that old.
but the person expired, so
Oh, and they
and-
can't collect from
No.
them through SDC either, right? I know
it
that.
shuts the door. And so, but what happened during that period,
Right.
I don't know.
You mentioned charting errors, like
Yes.
electronic health record charting errors.
Yes.
That maybe the new electronic health record we need to fix.
That's what we're told. Yes. Yeah, good point.
A little return on your investment there
Yes.
to make sure that you.
Oh, okay, so the EXP means that the person is expired.
Yes.
Oh,
Well,
okay.
that's what on the
I didn't know what
bottom.
that meant.
On the bottom.
Oh, but I didn't expired what?
Oh, okay, yes,
Oh, it's the person, okay.
yes, that's
Yeah,
what
that's
all
hard to
these
collect
are.
from them.
Yes.
And then I know SDC won't even look at them once
No.
they're, yeah.
And if you look at this, some of them are all the way back to 2013 that they had their stay. But so our team, they do bird dog and to get money.
Sure.
So it's not a matter of giving up, and that's why that one is kind of glaring, and I'm not certain what happened.
Yeah, and just the comment then too, on maybe the new electronic health record be able to like capture this more and have, evidence. Could you refresh our memory on your plan to assess the return on your investment for the new electronic health record? Do you have a means set up where, oh, look at now we captured whatever, $500,000 more worth of expenses with this new electronic health record, which maybe in the past we wouldn't have. I know healthcare systems have processes. That's not my world.
Right,
In
right.
healthcare, but I know that there are people that have figured that out.
Yeah, and I don't know if Taya would like to add anything to that, but I know, part of the implementation of the new record and the training for the MDS coordinators is to assure that we're coding everything and not leaving anything on the table when it comes to that coding. So they're going through all of that training. And I think certainly that would be part of, much like Human Services has been looking at sort of the year over year increase in capability, that will be part of the things that we look at when they just went live. I think that was in your report with it for the fields, and then they're working on implementation for the SNF, so.
Okay. Yeah, because some healthcare systems too, when they switched, electronic health records and made upgrades, significant amounts of money have been lost in the past because of coding or things that were missed in the rebuild or the switch. And it can really cost it can have that opposite effect too.
Right, yeah.
Yep.
We will definitely be paying attention to that.
And going to what Peter had said, would it be a big deal if we said to hold this off until next month until we could get that information? But I just want to.
I prefer that you approve this only because we've got to close the books. And regardless of the report, they have expired.
Right, okay.
And so, but you will get a report explaining.
Okay.
Okay, and any potential interventions if there's a theme or how to prevent it in the future?
Absolutely,
Oh, that would be good too. Thanks.
absolutely.
Okay, so if there aren't any other questions, then I'd entertain a motion to approve the noted write-offs.
I motion to approve.
I'll second it.
All those in favor, please signify by saying aye. Opposed, and that motion carries.
Thank you.
And then our next meeting date is Wednesday, February 23rd. And I'm sure we'll all be good and healthy and be at that meeting as well. So there being no further
I think I've
business.
had everyone out there by now.
There being no further business before this committee / board, we are adjourned. Thank you, everyone.
Thank you.
Thank you.